Evening, everyone. Hi, I'm Matthew Traynor. I'm Chief Executive of Oxleas NHS Trust. And Richard promised me an event with some fantastic brains on display. He was right. Right, one voice I've heard in the 6 months since I've been at Oxleas is that of a man I often see when I visit the Bracton Centre. The Bracton Centre is a secure hospital that we run in Bexley. The Bracton's a specialist hospital. It provides forensic mental health care. And forensic mental health offers assessment and treatment to people with severe mental disorder who pose a risk to themselves or others. And most of these people have been convicted of a criminal offence. This man is called Michael. He's in his early 50s. He's about my height. He's got shaved head. He's bigger guy than me. His manner's guarded but friendly, and he tends to avoid eye contact. He looks into the distance when he speaks to me, rather than looking me in the eyes. And there's a hurt look on his face, and he has that look about him, and you can tell he's experienced pain. Michael grew up in southeast London, not too far from the Bracton, and he had a difficult childhood. There was a lot of corporal punishment in his upbringing. Strict upbringing, and his behaviour was difficult as a result, and he started smoking cannabis when he was aged 10. He truanted, he was suspended for fighting, he came into regular contact with the police, and this frightened 10-year-old who was smoking cannabis became an unemployed young man who used drugs and alcohol, and his friends were involved in crime. And I went to see him yesterday to prepare for this, and I asked him about his experiences growing up, and he said, I chose bad company, I wasn't interested in work. The bigger boys told me that if you do this, you'll be out in a few years, you'll still be a young man. If we rob someone, if we steal 100 grand, we'll be old men when we get out. Michael began then to experience psychosis. Psychosis is a severe mental disorder in which your thoughts and emotions are so badly impaired that you start to lose contact with reality. It can include hallucinations, it can include delusions, disorganized thinking and speech, and a person experiencing psychosis is living in a world we cannot see and would not recognize as the one we live in. Michael committed a very serious offence while he was in the grip of psychosis. He was arrested, remanded in custody, and his psychosis was such that he was then transferred to Broadmoor, which is a high secure hospital. He spent years in there and elsewhere in secure services before he came to us at the Bracton Centre around 10 years ago, and he's spent every night of his life in a secure hospital since 1987. Our clinicians see patient after patient who share elements of Michael's experience. They see the thread of childhood adversity and abuse in a dysfunctional family. They see a lack of engagement with education, substance misuse, criminality, and the onset of severe and enduring mental illness. And one of Michael's doctors told me the biggest difference between patients who she sees who've committed the most serious offences and those who have not is neither the diagnosis nor the severity of their illness. It is purely and simply the barren hinterland of their childhood. I asked Michael what might have made a difference to him or to children like him, and he takes full responsibility for what he's done. He doesn't try to evade the choices he made, but he said structure and support from an early age. He said education, job prospects when I left school, and he said deterrence when I offended, proper deterrence when I offended. And clinicians who work in secure mental health, they face this reality of patients who by the time they get to them, the die is already cast in terms of their life. Their lives have already reached the point that most of us would see as broken. And these clinicians, they strive to offer non-judgmental compassion, to offer a safe environment to people who've never experienced this before in their lives. And for many patients, the security and care offered by these therapeutic relationships is something they've never previously experienced. And Michael told me about the impact of his care and treatment. He said, I've stopped hearing distorted voices. I know about right and wrong. I know how to understand empathy more. I know violence is a no-go. I was possessed by evil. I didn't know what was going on, and I know that now. I had no idea what I was doing. And mental illness affects who we are at a very fundamental, very personal level. But mental well-being can only be sustained and mental illness treated successfully by supporting both clinical recovery and personal recovery. In a life with positive relationships, a decent place to live, with goals and with meaningful work. I asked Michael what he thought of when he thought of himself in 10 years' time, and what he said was, he said, if I'm still alive, I could be gardening, I could be plastering, I know how to frame pictures, I know how to valet cars. He's learned all this in the Bracton. I know about work now, and I know how to work up the ladder. I didn't know any of that when I was a kid, and hard work now is like medicine to me. And after 8,000 nights now in secure care, I said to Michael, where would you go now if you had a night away to yourself? And he said, I'd go to my mum's in Lewisham and then I'd come back here. And he was alarmed by the idea, and he's preparing to move on now to a less secure setting. But the challenge of leaving the one place in his life where he's formed relationships with people who he trusts is daunting for him. So Michael, he was a 10-year-old boy, smoking cannabis to help him come to terms with what was going on with him in his life. He was a 21-year-old man who committed a terrible violent crime while he was in the grip of psychosis. And he's also a 53-year-old man with no prior adult life to return to. He's seeking instead to renew himself and live out his life in peace using the tools he's learned within the secure hospital system. And voices like his, and those of the many clinicians who work in forensic mental health, are not often heard. Forensic services do incredible work. They do it quietly and effectively, seeking to treat our very highest risk patients and offenders. They are not well served by news stories and headline writers. There are 60 medium secure hospitals in England with around 3,500 people living in them. And there are more people in high secure and low secure environments. But forensic patients, they're presented to us as a threat to the vulnerable, when up until the point at which they committed that offence, they were among the very most vulnerable of us themselves. One of the reasons, Richard asked me why I sought Michael out, and I wasn't going to say this, but then he said I should, was I've been treated for depression and for mania since I was about 14. And I did that in the context of a loving and supportive family with good friends and receiving access to good quality healthcare. And there's been times in my life where I wasn't sure whether I'd be able to function properly again. And to try to imagine what it was like for him to do that without any of that support, you think very much, there but for the grace of God could go any of us. And to see in that 53-year-old man, that 10-year-old boy, and to balance that against the lives he's destroyed, and he recognises he's destroyed, to offer care and compassion without judgment, this is part of our National Health Service. And I asked him about recovery, and does the concept of recovery mean anything to him? And he said, I do believe I've been wounded. I've hurt people. I've destroyed some people's lives. I do believe I am recovered. I will close that wound. I will heal. I think I have a future. I haven't given up. I am still alive, and life is precious.